Hello, I'm Dr. Jang from Note Plastic Surgery. Lately, during consultations, I've been getting a lot of questions that people hardly used to ask before, such as, "Doctor, I'm on Wegovy. Can I still have surgery? I'm taking ADHD medication. Will that be okay? Do I need to mention antidepressants or panic disorder medication too?" These are all questions about taking different kinds of medications. To give you the short answer first, if you're taking any kind of medication, you absolutely need to tell us exactly what it is. It's not necessarily that the medication itself is dangerous, but it can affect general anesthesia and the surgical process. So today, I'll go over 3 of the most common types of medication people ask about these days and how they relate to surgery under general anesthesia. First is Wegovy and Mounjaro. These are the medications I get asked about the most these days. Wegovy and Mounjaro were originally developed to treat diabetes, but recently a lot of people have been using them for weight loss. These medications slow down how the stomach moves. Simply put, they slow down how quickly food moves from the stomach into the intestines. But under general anesthesia, the reflexes that protect your airway temporarily go away. And if there's still food left in the stomach, it can come back up and enter the lungs, causing a dangerous situation like aspiration pneumonia. That's why anesthesiology teams have recently been paying very close attention to whether you're using Wegovy or Mounjaro. A lot of patients ask, "I fasted the day before anyway, so isn't that okay?" But even if you did fast, these medications can delay stomach emptying, so there may still be some food left behind. That's why you need to discuss it with your medical team, and your injection schedule may need to be adjusted. Second is psychiatric prescription medication. One example is ADHD medication, which a lot of people are taking these days. Common examples include methylphenidate-based medications and amphetamine-based medications. These medications can help with focus, but they can also affect your heart rate and blood pressure. During surgery under general anesthesia, the anesthesiologist is continuously monitoring and managing your blood pressure and pulse. So if you're taking these medications, you need to let us know. There are also medications for depression or panic disorder. Some of these medications can interact with pain medication or anesthetics used during surgery, and some can also affect bleeding. There are so many different kinds that I can't list specific medications one by one, but with these drugs, suddenly stopping them before surgery can actually make withdrawal symptoms or anxiety worse. So rather than deciding on your own to just stop taking them, the safest thing is to tell your medical team exactly what symptoms you're being treated for, what medication you're taking, and how much, and then follow their guidance. Third is birth control pills or female hormone medications. More people are taking these than you might think, and a lot of patients assume they have nothing to do with surgery. Birth control pills are medications that regulate female hormones. In some patients, they can be related to the risk of blood clots, that is, blood clotting inside the vessels. Of course, this doesn't cause major problems for most healthy people. But under general anesthesia, your body's movement is completely limited, and unexpected symptoms can come up during recovery. So from the medical team's standpoint, it's something that needs to be checked in advance. So if you tell us during your consultation or when you've decided to go ahead with surgery that you're taking birth control pills, the medical team can decide, based on the type of surgery and your overall health, whether you should continue them or stop them temporarily. Some people think, "It's just birth control. I probably don't need to mention it." But it's actually one of the important things that absolutely needs to be checked. So if you're currently taking birth control pills or any female hormone medication, it's best to tell us the name of the medication as well. To sum up today's video in one sentence, it's best to share everything in as much detail as possible ahead of time. Taking the medications I mentioned doesn't necessarily mean you can't have surgery, but it can be risky if the medical team proceeds without knowing about them. So when you come in for a consultation, Please make sure to tell us about any medications or injections you're currently taking, and if possible, bring the medication names with you too. I hope you'll remember that safe surgery starts with sharing accurate information. Thank you.